Okay, so let's get started. Good afternoon, everyone, and welcome to today's webinar, Cooperatives and Coalition Building for Just Home Care. My name is Michelle Christman, and I'm the Education Manager for the Ontario Cooperative Association, and I'm delighted to be here with all of you for this important conversation. Home care is something that will impact all of us at some point in our lives, whether as a client, a family member, or a care worker. Today's session will explore how we can transform home care into a more just and people-centered system. We are honored to have two incredible speakers with us today, Danielle Turpin from the Home Care Workers Co-operative and Cooperative Care Alliance, and Mary Jean Hande, Assistant Professor of Sociology at Trent University and Academic Lead for the Towards Just Care Research Partnership. Together, they will provide valuable insights into the current state of home care from both worker and client perspectives and discuss the role of cooperatives and coalition building in shaping a more equitable system. This webinar is part of the Ontario Cooperative Association's IYC webinar series, commemorating the UN-designated International Year of Cooperatives. Throughout the year, this series will highlight the transformative power of cooperatives and their positive impact on community well-being, both here in Ontario and across the globe. At OCA, our vision is to support a cooperative sector that is growing, innovating, and building a better Ontario. Before we begin, we acknowledge that the land where I join you from today is the traditional territory of the Anishinaabe, Huron-Wendat, and Haudenosaunee. This territory is covered by the Williams and Upper Canada Treaties. Let us recognize the deep connections Indigenous peoples have to this land and acknowledge our responsibility to work toward reconciliation and justice in all aspects of care and community building. Before we dive in, a few housekeeping notes. So this webinar is scheduled for 90 minutes. We'll have approximately 60 minutes for Danielle and Mary Jean, approximately 25 minutes for the question and answer portion. The session is being recorded and will be shared following the session. We ask that you please reserve any questions until the Q&A portion of the webinar. Or feel free to note your questions in the chat throughout the presentation portion of the webinar. I'll be monitoring the chat and will ensure all questions are addressed as much as we can during the Q&A portion of the session. If you experience any technical difficulties, please let us know in the chat and we'll do our best to assist you. And I would ask that all participants remain on mute throughout the presentation portion so we can all give our full attention to Mary Jean and Danielle. That, I'm pleased to introduce today's speakers. Danielle Turpin is a personal support care worker, founder and CEO of Home Care Workers Co-operative, where she champions innovative worker-led solutions in the home care industry. With a passion for social justice and community empowerment, she also serves as the co-founder and executive director of the Cooperative Care Alliance, promoting cooperative models that enhance care work and support caregivers. Danielle's leadership is rooted in her commitment to improving working conditions, ensuring fair wages, and fostering collaboration among care workers. Her initiatives aim to transform the landscape of home care, advocating for both workers and the individuals they serve. Mary Jean Hande is an assistant professor in sociology at Trent University. Her community-engaged research focuses on aging, disability, immigration, precarious work, continuing care systems, and struggles for social transformation. She is the academic lead on the Towards Just Care Research Partnership. I'll now stop sharing my screen and I will turn it over to Mary Jean and Danielle.
Thank you so much for the introduction. So I'm going to share my slides, and I'm also going to put, actually before I do that, I'm going to put a link to our recently published toolkit, which I'm going to be referencing in the presentation. So this is our Towards Just Care toolkit. It's called Just Care Dreams. And it's kind of an overview, and it actually has a little spotlight on Danielle Turpin and the Workers Co-operative. So check that out and follow along if you want. I'm going to share my slides now. Hopefully this works all right. Does that look okay for everyone? Okay, great. So, so I'm Mary Jean Hande, and I'm a sociology professor at Trent University, and I also work with the Trent Center for Aging and Society. And I also have worked as in Saskatchewan, what would be the equivalent of a personal support worker in several home care and nursing home environments. And my mother lived in a nursing home for 24 years. So those experiences definitely inform and motivate my involvement with this work, and really drive my kind of passion for kind of finding more just alternatives. The Towards Just Care project, or TJC, we call it, it really builds on a lot of people's lived experiences and builds bridges with people who have all sorts of different kinds of intimate connections with home care systems. So the focus is really trying to bring in the people who are most impacted by home care and have those lived experiences. So I want to acknowledge key co-authors in this presentation. Megan Linton and Brad Evoy with the Disability Justice Network of Ontario. They were our kind of primary partner in the research. Sarah Malik and Leah Nicholson were staff on the project, and they are now working in other areas, but they played a really huge role in developing the toolkit. And then the graphics in the toolkit and in the presentation here were developed by Nelly Agbulos and Habiba Hagag, who are also staff on the project. So I want to give them their shout outs. And I'll just a little bit about our team. We have a really diverse team of academics and staff from across Canada. Um, so they're all listed on the left here. We have most of them in Ontario and Manitoba, but we do have a couple faculty members at UBC, and we're working on a new grant right now that incorporates some folks from Nova Scotia as well. And then a lot of this work was kind of driven by our Community Advisory Council. And these organizations all represent people who are kind of most impacted or have a huge stake in home care transformation in Ontario and Canada more broadly. So we have the Disability Justice Network, of course, and we've got we had a couple of national organizations, the Migrants Resource Centre of Canada, the Disabled Women's Network of Canada, and then some local groups, Seniors for Social Action Ontario, the Home Care Workers Co-operative. We had a group in Barrie called Filipino Migrants. They were predominantly PSWs, Filipino immigrant PSWs in the Barrie region. And then we had a couple of people who were representing that kind of client perspective. So Doug Carton, also a member of the Seniors for Social Action Ontario, but he's also a part of several circles of care support. So kind of providing that informal care, working with family members and other community to try to help people navigate the home care system. He was a huge wealth of information. And then Alessa DiVirgilio has been relying on home care services to avoid living in a nursing home for more than 20 years, and also kind of an expert on navigating the home care system just through her lived experience. And then we have an international organization informing the project, Margaret Oldfield, with Reimagining Dementia. And this is kind of an international coalition of groups trying to think about alternatives to dementia care, among many other things. But it's a really cool organization. So the background of our project is really thinking about the crisis of care in Canada right now. Demands for home-based or community-based care outside of nursing homes or long-term residential care has grown really, really rapidly along with our aging population. Many of you will recall, the media reports during the pandemic of a really a crisis state in nursing homes. And there was a national survey, the National Institute on Aging conducted a national survey in 2021, and more than 85% of the respondents to that national survey said they would rather die than live in a nursing home. So the demand is really quite high, and yet for home care, but home care is really poorly resourced and organized. It's currently not really a viable option for most people, and so people are kind of in some ways forced into nursing homes. There's also, ongoing and unprecedented worker shortages. Migrant workers are increasingly the dominant kind of demographic of workers in these institutions. They're often, especially during the pandemic, employed through temp agencies. They're kind of just-in-time workers through these temp agencies that are kind of shoring up a beleaguered workforce. And these care systems are, also homes and workplaces that are really rife, often with violence and exploitation for both workers and clients. Decisions around whether or not to go into a nursing home are extremely difficult. So as I mentioned, Doug Carton and then Megan Linton with the Disability Justice Network are really intimately engaged with people with very complex health needs, really trying to demonstrate that it is possible for even people with severe or highly, acute kind of care needs that to actually thrive outside of nursing homes. But this often really involves a lot of unpaid caregivers, close-knit communities, and kind of ad hoc circles of support to supplement the inadequate home care hours through a publicly subsidized home care system. So in our project meetings and visioning, all of these different people that are involved, these members of our coalition, have really shared a lot of painful stories about having to privately employ migrant care workers at poverty wages, or if that's not within financial reach, some people consider medical assistance in death. And that's a conversation that comes up very, very frequently. In our workshops, migrant care workers describe harrowing stories of abuse and exclusion from basic healthcare services. They fear growing older themselves and being separated from their families, who can't afford private care services that makes, home care possible. Often these care receivers and care providers are pitted against each other too, as if somehow their struggles for better care or better working conditions are separate or even opposing. And yet we know that both low-income care receivers and care workers struggle, their struggles for improved care and working conditions are really intimately interconnected. And our project really aims to build bridges and common visions and coalitions across care receivers and workers. So we start from a recognition that the existing system needs more than a few small tweaks and changes. And we really need to think about who's in charge and maybe bringing more people into those decision-making roles that have that lived experience, that direct experience. And so we're really calling for broader intergenerational grassroots visions and coalitions to really drive home care change in the province. So before going further into the project, I'm going to provide just a bit more clarity around what we mean by home care and who makes up the majority of the home care system. So here, by home care in this project, we mean everything from wound care, medication reminders, personal care such as toileting, bathing, grooming, and home care support such as meal preparation, laundry, yard care. We're not talking about just kind of temporary home care for the most part, but ongoing care needs. So people who have chronic need for care supports. Most home care is non-medical and provided to people over 65 who need in-home support with basic daily living. Providers range from occupational therapists, registered nurses, attendants, personal support workers or PSWs, companions, respite workers, etc. But PSWs really do represent the overwhelming majority of these workers. Unpaid family caregivers play a really critical role as well, in supporting clients and enabling them to live in the home. Um, and home care is highly gendered. Most home care receivers are women, and most family caregivers and most of the PSWs providing the care are women. It's a very, very feminized area. Home care work is really devalued. There's actually little data on home care work and home care workers, as most of this work is ununionized. And a lot of it happens in the private sector, including temp agencies, live-in care arrangements, under the table or cash jobs. So we don't really, and even definitions of home care across Canada are very, very different. So we don't really have a common terminology for understanding the home care system and collecting data. So there's the little data that does exist, shows that, workers are predominantly racialized immigrant women. They're at the bottom of the so-called care work hierarchy. So their jobs are very low wage and precarious. There's a large turnover. There was a recent study that said that most workers don't stay in these jobs for more than 5 years. So these are just some references here if you want to learn a bit more. There's a lack of investment in home care systems that can be attributed to a number of different factors. The lack of data makes planning, budgeting, and oversight difficult. Ontario's home care services are predominantly privately owned and operated with some government subsidies, but this makes it hard for governments and the general public to provide direction and accountability to how these systems function. And historically, we tend to defer to private companies to call the shots on how these systems function. And I'll get into more detail about that in a few minutes. There's also widespread ableism and ageism that devalues the care receivers, and by extension, the care. So we have normalized in many ways the poor care of older people in Canada. And so we've come to settle for less, I think. Care receivers struggle to demand and expect more from a system that devalues them and reinforces this kind of care scarcity. So we hear this a lot from the people involved with our project, the seniors, disabled people, and caregivers alike, talking about this kind of, just culture of just trying to get by with a very bare minimum and working from a place of scarcity and austerity. And so this became a really big thing that we were trying to address in the project. As a project, we take a social justice approach to challenging this devaluation and really thinking about how can we move from a scarcity approach to thinking about thriving, and really flourishing in these systems. So our partner, the Disability Justice Network, our primary partner, is a community-based organization that aims to build a more just and accessible Ontario for anyone living with disabilities. And the goal of this project, initially at least, was to provide resources and tools and analysis to support their recent campaign to deinstitutionalize care, to develop a more intergenerational campaign to deinstitutionalize nursing homes, and develop more public community engaged home care services that promote justice in care work and care infrastructures. So in other words, we want to build a home care system that allows people to have a meaningful choice around where they get their care and to feel like they can really flourish despite having care needs. And fundamentally, this framework calls for us to challenge notions that care is inherently scarce and to push us to imagine and build a more robust and abundant care system. So this includes reconfiguring care relations towards what we call just care work by bringing marginalized communities into conversation with each other to develop disability and migrant justice-led home care alternatives that build solidarity and coalitions across seniors and other equity-deserving communities. So the goals of the project respond to the key tenets of disability and migrant justice, which work towards cross-movement solidarity. And by centering relationality, which I'll discuss a bit more in a few minutes, and forging new alliances, this project's academic team and community partnership bridge many of the divisions that currently exist in the sector. So I'll just review a little bit about what disability justice is. So disability justice is a cultural movement and framework dating back to the 1970s, when deinstitutionalization campaigns were underway and really in their heyday in the United States. And historically, disability justice has responded to the limits of more mainstream disability rights organizing, which was overlooked the perspectives of people with invisible disabilities, cognitive impairments, and Black, Indigenous, and racialized people, queer and trans and non-binary people, women, and transnational diasporic communities. So they're really focused on broad, diverse coalitions with various community organizations to ensure the movement's success. And so you can see some of the things. There's a focus on intersectionality, leadership of those most impacted, not only solidarity across different types of care receivers or people with different disabilities, but also across movements, thinking about interdependence. I would add intergenerational focus there, thinking about the sustainability, collective access, and collective liberation, and also thinking about how important it is to challenge capitalism and all of that. Migrant justice has a bit of a different history, but has also been really important for our project. So this graphic was developed by one of the artists on the project. And the commitments of migrant justice listed here were articulated by a migrant justice activist, Lenny Rose Simbra, who spoke at one of our workshops. And really focusing on recognizing the undervalued, overworked, and invisible migrant labor that really drives our home care system. Again, there's a focus on intersectionality, thinking about care as a universal experience. So not just people with certain diagnoses, but everybody needs to be cared for, including the workers and immigrants that really support the system. And then thinking about solidarity across movements and borders. So this is a graphic that we developed just to kind of give people an understanding of how we see these frameworks fitting together and looking at some of the points in common between them. So this kind of purple, overlapped area here in this Venn diagram kind of highlights some of the shared values or principles of these two frameworks. So you can see things: cross-movement solidarity, collective access, universal human need for care, interdependence, leadership of the most impacted. There is an anti-capitalist politic. And also this notion of kind of critical hope for a better future, that we don't need to settle for what we have right now, that we want to really focus on imagining and working together for something that's better than what we have right now, and not just surviving, but actually thriving. So the activities that we've done are we mapped the Ontario's existing home care systems, both from the perspective of what are all the services that are available, but also who owns those services and who financially benefits from those services and who's eligible for those services and who's excluded. So I'll go into the mapping in a few minutes. We, of course, focused on coalition building. This was done through the development of the Community Advisory Council that I mentioned earlier, but also various meetings, and we did have a fairly robust community visioning workshop that brought in a bunch of different home care workers and receivers to talk about their visions of care. We had a social media campaign, and of course the Towards Just Care toolkit, which is in the chat. The link is in the chat for those of you who haven't looked at it yet. And then a lot of this is focused on the visioning. So thinking about how we can build trust and understanding across all of these different groups, recognizing that there are these historical tensions, and then generating ideas based on that lived experience and that those kind of finding points of contact in these what are currently fairly separate kind of advocacy initiatives, trying to think about how can we join these initiatives together and build some common cause. So these maps are quite involved. So I'm very happy to go into more detail later on about them. But for now, I know that you won't be able to see the detailed text on this map, but I just wanted to give you this kind of bird's eye view to kind of show you how complex the current service structure is in our home care system. So this is mapping, and this isn't even an exhaustive map, but this is the primary kind of services that are available, all the different agencies. Some of them are subsidized by the government, some of them are not. But this is mostly these are mostly the ones that are promoted by government agencies. So for care service users, this type of map, we're hoping, and it's on pages 19 to 24 in the toolkit, we're hoping that this will help people to understand who's providing the care, who's funding it, who's responsible for it, and who's profiting from it. So we look at, like who are the agencies involved, if they're a subsidiary, if they're profit, nonprofit, if they're unionized. And then for the workers, also understanding, what are their records, right? We have links in the map in the toolkit that will give you ideas about, what is the history of these agencies? Have there been, is there some sort of historical taint to them, right? Have they had complaints against them? Have there been lawsuits? How are the workers treated in these organizations? And then also for friends and family who are trying to support people who are managing or trying to navigate the system, really just trying to provide a bit more transparency around the profit structure of home care providers, particularly the larger companies, the businesses and the political figures and entities. So the second map is looking much more at the power relations. So I'm going to navigate here to the link here. So hold on a second. I'm going to stop sharing this. And hopefully I can share this website here. Can everybody see this? It says mapping Ontario's home care paramed. Okay, great. So this is where the paramed was really the focus of the mapping. But paramed is the largest home care provider in Canada. It makes about $1.5 million in profits annually. It made a huge profit during the pandemic, huge profits during the pandemic. It says here in 2023, it delivered 9.9 million hours of home care, 94% of which was in Ontario. So it's a huge player. There's all sorts of different details in here and in the toolkit. So I'm not going to go through all of it, but it shows how it's connected to some of these other major corporations like Extendicare, Chartwell Retirement, why it's implicated in these different systems and how that actually links home care profit making to the long-term care sector, even though for most people they want to see it as an alternative to nursing homes. In many cases, companies like Extendicare have really just diversified their portfolio by adding home care to their list of services. And so the model of care remains very similar, even though it's not technically taking place in a nursing home. We also show connections to, who's financing things like Extendicare. So there's a history here. There's all sorts of references that you can check out. So it's showing here this connection to Formation Capital. and then some of the other connections, Axiom, Chartwell Senior Housing, Riviera. So we're looking at how retail investments are becoming really implicated in the home care system. And really why these systems are really are driven by profit and not really serving the interests of the care receivers or the workers. The huge amounts of profits that are being made while workers are getting paid barely above the poverty line, right? They're very, very poorly paid. And also just thinking about, the people who are making the decisions about these services and are really organizing them are not people who even have any expertise around care, right? They're basically just, they're financial managers, right? So these maps have been really exciting for a lot of people who are advocating in this area and have really been useful for building coalitions. So I'm going to get back to my PowerPoint here. All right, so everyone can see that again. So in general, thank you, Michelle. So it's really exposing the vast networks of people, organizations, businesses, political and personal relationships. We see Mike Harris very much invested in these home care systems, how these networks hold power and influence the system, um, and how we need to organize in some ways to develop meaningful alternatives. So for disability and migrant justice movements, power networks can be an area of political education and action. Workers and recipients can use this information to identify strategies to build a system where the benefits are reaped both by the workers and the recipients, and meaningful work and employment can be made. We're currently developing a new kind of grant where we're hoping to do a bit of a deeper dive into the private colleges that are training workers, the international recruitment efforts. So, in some of these agencies are also serving as they're serving as temp agencies, but also as immigrant recruitment agencies. And so we're really trying to understand, all of these different relationships and how we can put forward alternatives based on what we understand of these systems. So this is an overview of Extendicare's board and their networks. And so you can really see, we call this a wealth care rather than a healthcare network. And it's currently, they play an oversized and critical role in driving our home care design, planning, and decision making. And these powerful home care actors dramatically contrast with the actors of those who are actually making up the majority of the home care system, the receivers, the workers, or the PSWs. Those are not the people that are represented in these boards and networks. So we're really trying to highlight those types of things in the project. So, and in contrast, we're trying to develop a grassroots visioning process by those who are most impacted. So our project has aimed to provide an alternate lens on home care by amplifying these grassroots perspectives. And we really contend that those receiving and directing home care understand home care best and should be working together to provide alternatives and different visions of home care. So again, these are the members of our advisory council. And we've added a few new people into that. We've also working with an Injured Workers Action for Justice group. It's a predominantly immigrant group that's been advocating for better working conditions and better access to care. We had a visioning workshop, which was it was in October 2023. And this was really focused on building understanding and trust, as I mentioned earlier, and collective ideas about how we can build change, build coalitions between these different organizations. And we targeted those most marginalized in home care making processes. So low income home care receivers, migrant care workers, and we also welcomed other interested people and groups who are interested in grassroots mobilization for home care changes. So In the end, we had 37 participants in this initial visioning workshop. Most of them were workers, which was really exciting for us. And I think really shows the desire of workers to be involved with these coalitions and making change. We asked participants to think about a moment when something in your work or care went well, what made it work. And participants shared that strong relationships situated in communities, care that was reciprocal or relational, where they felt like they could work out, the best terms that the care would be, done. And they had some opportunities to pivot and change, like work out mutually beneficial arrangements for care, having a systems that fit their care needs. The collaboration between workers and receivers was really important for people in the workshop, starting from a place of empathy. These were all things that were listed as important ingredients for just care and just work experiences as well. So these are just some, general bullet points from the workshop here. And I think this is going to be shared after the workshop too, or after this webinar. So don't worry if you can't see all of the detail. And this is also summarized on pages 45 to 46 in the toolkit as well. Next, we asked participants to imagine 5 years into the future and what would a perfect or just home care system look like. And broadly speaking, this looked like having diverse care needs met, including housing, social needs met, balance and power structures, a sense that care users and workers had the power to hold systems accountable when they weren't working properly, a sense of security about the future, not worrying that they'll suffer or will be forced into undesirable life situations because of poverty or lack of resources, not worrying about some sort of retaliation if they make complaints, fundamentally adequate staffing in home care. So staffing levels or in supporting staff, home care PSWs in particular was really important. And this involved, having respect in their jobs, good pay, breaks, ability to rest and take vacations without worrying about critical scarcity if they take a break. And it's really clear that these groups understand that system changes need to be broad and holistic. So they're not just organized around like task-based activities or just, things that involve bodily care, but they're really things that focusing on the relationships in home care, and that these are really necessary to make just care a reality. So through this visioning and the coalition building and the mapping, we developed a just care framework, which is organized around 3 pillars. So I'll just briefly review the pillars here. So publicly owned and directed. So this involves things like it being non-market, non-institutional, so not using that top-down kind of logic. It's accessible both financially and logistically, that care receivers and workers have power and voice, decolonial and relational, and I would add intergenerational to that as well. So addresses experiences of violence and discrimination, which, as I mentioned earlier on, are too common in this system right now, that there is that flexibility. Care worker security is equitably negotiated. Care delivery and tasks are reflexively modified as they needs and preferences change. And then a system that is sustainable and inspirational. So this includes things like making sure that workers are not separated from their families, that they have a future in Canada, that we can keep them in the system, that they have that they see this as a career, not just a stepping stone to get into a better paying job or getting their permanent residency. Safe and healthy working conditions, living wages or salary, opportunities for growth, opportunities for continuing to reimagine care, right? Not that's not a static process, that there's room for people to really be actively involved in shaping their future. And again, that thinking about a commitment to thriving and not just surviving in these systems. This is just an infographic or just a graphic that was developed actually by Sarah Malik, another staff member on the team, to kind of show a bit of how we see, the contrast between what is currently existing and where people would like to go. So some people have compared nursing homes to a kind of a carceral system. So we're looking at kind of moving to a system that helps people flourish, looking at moving from a routine and impersonal system to a dynamic and compassionate system, moving from scarcity to abundance in care options, moving from hierarchy to collaboration, task oriented, and more sustainable approach. So one of the things that the questions that I get when people, when I give this presentation to people, people think, oh, this is really pie in the sky, right? Nobody's doing this work. But the real thing that's really exciting about it is that there are a lot of people who are already developing these models. And I would say that, Danielle Turpin's Home Care Workers Co-operative is a really great example of that. And so we're really excited to share examples of cool, what we would is just care initiatives in the toolkit. So there's several kind of peppered throughout, and just examples of where we can find care abundance in our communities right now, and how those might inspire us to work towards broader visions in the future. So you were looking at current initiatives. We feature stories of advocacy, including the Home Care Workers Cooperative, looking at the role of cooperatives in changing these systems, making them more equitable. We worked on debunking myths about home care scarcity that we often hear from, like agencies and things like that, and talking about how people are thriving outside of nursing homes. So something to check out. And I hope that you find we're happy to get feedback on the toolkit too. I think my email is in the toolkit. But we really do want to expand this a bit further in our next project. Hopefully we'll get the funding that we've applied for. But we're really trying to help foster that coalition building process, give people hope and examples of things that are working and exciting right now, and then provide some tools for that alternate visioning. So this is the new kind of coalition that we've extended to. So we've added Age Friendly Peterborough, who Danielle Turpin works with quite closely. We've got another disability organization, Eviance, who's done a lot of home care advocacy, and the Ontario Council of Agencies Serving Immigrants. And we're hoping to continue to build the coalition moving forward with the project. So yeah, I'm excited about it. We've got a lot of really positive feedback. We just did a presentation, I think it was just before Christmas, with a housing cooperative, a seniors housing cooperative that is also a naturally occurring retirement community. And they were, trying to use some of this toolkit to develop connections between their home care or their housing cooperative and building better initiatives for them and to access home care in their housing cooperative. That was in Toronto, but I think there's lots of opportunities, and I'm looking forward to exploring some questions about the role of cooperatives in coalition building and making care more just. So I'm going to pass it off to Danielle now. Thank you, everyone. Is that okay, Danielle? Is this
Yep.
is
Yep. No, that's good. Thanks, Mary
Oops,
Jean. And
sorry.
I have to say, I've heard this and participated in this presentation many times. And every time I pick up something new or something just kind of triggers my thought process on this. So I love hearing it and being a part of it. So welcome, everybody. I am Danielle Turpin. I am a PSW. I'm also the founder of Home Care Workers Cooperative, as well as the co-founder and executive director of the Cooperative Care Alliance. So we heard a lot about the systemic issues. We heard a lot about the problems of workers in the home care sector, of the care receivers in the home care sector. So now we're going to learn a little bit about some of those solutions. This is the part of that process where we can really talk about hope and talk about those solutions. So you can, next slide, MJ. Oh, is it working? Yep, there we go. So when I made the decision to leave home care, I was working in a long-term care home, and I really felt that that was going to be where I wanted to be. It was a publicly funded, nonprofit, partly community-owned long-term care home, and I thought, okay, and it was good working hours and fairly decent wages. So I felt this might be the best fit. And even though I kind of jumped around from sector to sector, I realized that no matter where I went, I really felt complicit in some of the problems, and I wasn't really able to find a way to fix them inside the system. And I realized that the issues are systemic, as MJ was talking about. These issues are not a facility issue. These issues are certainly not a worker issue. And I wanted to find a way to develop a work environment for myself initially, but then also for other PSWs, so we can give the care receivers the quality care that they deserve and should get. Next. So I'll go over this just briefly because I know Mary Jean did speak to this, but we hear a lot in the media and the news. We're hearing a lot now as well regarding the current campaign that's going on. But there's a lot of issues when it comes to home care and PSWs and the knowledge of what a PSW is. PSWs are the largest demographic in the healthcare by the number of workers, yet we have the least amount of influence and we have the smallest voice. Many of us aren't unionized, and if we are unionized, it's not a professional union. This is going to be a sector-based, not even a sector-based union, more of an employer-based union. There's lack of standards of care. So what we end up seeing is their PSWs coming from private educational systems, public funded systems, 6-week courses. There's just no overarching standard of care. So you go into, and home care has different types of care plans for or care scopes than long-term care does, and vice versa. So you're going to see people in home care, retirement, maybe giving medication, and in long-term care, that's not allowed. So it's confusing. It's confusing for the workers. It's confusing for the public. The other thing that is quite confusing is that there's no professional organization at this point. So there's no formal group that can disseminate important educational and professional information so we can ensure that all PSWs are going to be getting the same information going forward about our work and the importance of our work and the standards and scopes of our work. As Aunt Mary Jean was saying, the PSW workforce is overwhelmingly racialized and feminized, and we see this. I mean, this isn't a new thing. The care force and the care labor force has almost always been overwhelmingly racialized and feminized. And when we see this, we're also then seeing low pay, long hours. This is necessitating multiple jobs in the field. It is not uncommon to see PSWs working in long-term care and then doing a couple of other jobs in home care and maybe picking up private cash jobs. That is commonplace. This is like this pervasive precarious work is in the largely for-profit industry, and that mapping showed really clearly what we're up against, what this really looks like, and the effects of it, and who's benefiting from it. There's a clear message that our care system right now is prioritizing profit over care, and is prioritizing profit over working conditions. Go ahead. So we spoke about, we've heard a little bit about the existing system and its impacts on employees and care receivers, and I'll go into it a little bit more from the worker perspective. Workers are alienated from one another, so there's very little solidarity that can develop. When we were going even through some of those visioning workshops, it was really hard to even get PSWs to be able to participate because they're working so much. They don't have standard schedules. It's hard for us to be able to communicate and just kind of, collect information and talk about our job. We're fragmented geographically and by sector. So we have care sector, PSWs, home care sector, we have retirement home PSWs, we have long-term care home PSWs, hospital PSWs, and sadly, we all don't work together collaboratively to kind of have a big, strong voice. So what happens is we end up kind of, I always say, kind of fighting at the bottom for scraps, as we are, as Mary Jean said, that lower level in the hierarchy in the care sector. So we're just going to be grabbing whatever we can. So when we see, long-term care sector workers getting more pay and home care workers aren't, or retirement home care workers not, we tend to be fighting amongst ourselves as opposed to looking at the systemic issues and the government issues that is what's causing this. This is not considered a profession of choice, and I'm really hoping to change that. We're all hoping to change that. It's often seen as that stepping stone to nursing. It's not uncommon to hear even professors talking about, and college professors talking about, oh, you should get into nursing. You'd make a great nurse. So we want to change that narrative. And make sure that giving good quality care to people and making sure that they can stay in their homes in a very safe way is a wonderful profession. And we just want to make sure that it's going to be valued as well. Go ahead. So this is kind of where the co-op model comes into play. We've talked about a lack of voice, a lack of a meaningful work environment, a lack of autonomy and decision-making when it comes to the type of care that you're going to provide. So this co-op model as a worker co-op, we really wanted to make sure that it offers that empowerment for PSWs. We are a female-owned PSW, nonprofit worker co-op, and we did that for the reasons discussed before. We wanted to make sure that women in the care sector, and particularly racialized women, have an opportunity to be empowered to get into entrepreneurship in a very supportive environment. Our worker co-op made sure that the supports for the PSWs are there, and these really aren't luxuries anymore. Everybody needs benefit and sick days and fair wage. So we made sure that our PSWs have medical and dental and mental health benefits. They have 7 paid sick days. We are, I would say, quite confidently the highest paying worker co-op or the highest paying care agency in Peterborough area anyways. That is not government funded. And we want a collaborative and democratic voice, meaning that these PSWs are going to have that very clear pathway to ownership. There is definitely a genuine appreciation through that meaningful decision-making and work. It's not just asking PSWs for their opinion. It's not a suggestion box. When they have a voice and they have a vote, that is implemented into action. We've created the Cooperative Care Alliance, and I'll speak to that very briefly in a few minutes. But what we decided is how can we help grow these co-ops across Ontario and hopefully across Canada. And what we really wanted to do is make sure that we're not just growing individual businesses. We wanted to grow and have a movement of just home care. We wanted to have a movement of quality, meaningful home care work throughout Ontario. And to me, that really meant that we needed to have an overarching organization that can oversee all of the co-ops that we will be developing. And then we can support them by doing that. Next slide. So the HCWC solution is improved compensation, income stability. We reduce the work, that precarious work that we were talking about, and that gig work, the private work, and we're going to be enhancing care quality. Member owners have that decision-making power, enhancing that personal investment in the co-op success. And we are seeing this come to fruition a lot with HCWC. Our member owners are growing dramatically, but not only that, they are so invested. They're engaged in the community. They're out looking for clients. They go above and beyond for their clients because they have been able to build that meaningful relationship. It's going to reduce the reduction of burnout because we don't need to have multiple jobs anymore. We have our jobs, we have our schedule, we go home, and we have that work-life balance. The PSWs, as I said, have that ability now to have that relationship. To me, that's the start of any quality home care is going to be, any care is going to be a meaningful, trustworthy relationship. Next slide, please. We've heard about the benefits for care receivers. We've heard about the benefits of our workers, but it doesn't stop there. With a co-op, co-ops are best kind of locally, locally owned and locally developed based on the needs of the co-op, and that there's no exception here for HCWC. So what we're seeing is better quality of care for clients. We have a minimum time per visit, and this is going to create relationships and not just check sheets that we have to do, right? And then we run out the door. The clients have a choice in the type of care they receive, when they receive it, and by whom. So our company doesn't go in and say, well, we can come to you at 5 o'clock for your shower on Wednesday and whatever. It's really the clients dictate the type of care and when they get it. There's always going to be regular PSWs going into their home. And depending on the hours, we will build a team around that client. So they all understand the care plan. It's always the same, ongoing. And again, back to that relational type care. Co-op models, keeps money in the community. So as you know, we saw in the mapping, when we're looking at who's benefiting and who's kind of got the power when it comes to home care, what we're seeing with Home Care Workers Co-operative is it's the workers have the power, the community and the workers hold the money, and the clients receive and have the power. So there's no money going off to distant shareholders. This all stays in the community. We are working with other local minded organizations such as Age Friendly, Trent University, Senior Social Action of Ontario. One of the initiatives that I've been working on, and I can touch on this later, was the NORC Ambassador Program, so those naturally occurring retirement communities. And we've also developed a new autonomous co-op in the York Simcoe area of Ontario. And each cooperative is fully autonomous and supported by the Cooperative Care Alliance. Next slide here. You can go ahead and skip this because yeah. I just want to kind of go to the end here. You can skip this one too. I think we know. So the Cooperative Care Alliance is going to act as a business incubator to empower the care workers and develop their own organizations in the care sector. So the Cooperative Care Alliance provides business supports and marketing plan development, bookkeeping and accounting, governance and management training, and human resources supports and policies and practices. Go ahead. And the support really is about gradually developing that entrepreneurial capacity from individual PSW member to organization member. There's no time limit on this. It's just going to be as organic and natural as we can make it. We found from my own experience that many PSWs, including myself, kind of lacked that business training and find developing business kind of daunting. So we take that and remove some of those obstacles in hopes to really empower folks, women in particular, to get into entrepreneurship. Go ahead, you can change that. I'll speak very briefly and then you'll be able to see it in the slides. In order to support PSWs and kind of bring in that overarching support and kind of an organization, we also created the Virtual Caregiver Network. This is a platform where PSWs have access to a range of online resources, workshops, training modules, and they're designed to kind of enhance their knowledge and skills in providing care to the clients. This is free for all PSWs anywhere. And ultimately, it's to ensure that the information that is being disseminated, whether that's legal, whether that's care policies, what's going on in the legislation regarding care work, it will all be in one platform. There's also a peer-to-peer platform that is moderated and private. So PSWs can go to and kind of debrief and have their own safe community to talk about some of the issues and concerns and tips and tricks that they may have. Next. So ultimately, what we've talked about is some of the problems, what we've been looking at and trying to find a way to improve this system. And it's essential that we empower and involve the key stakeholders that are most affected by the system. And I think this seems to be a key phrase that we've been using a lot, is empowerment of those key stakeholders. Who are the decision makers? Who are the ones who are most affected by the home care system? We include their perspectives, we make them drivers of that change, and we can ensure their needs can be met effectively. We need to explore the publicly funded alternatives and replicating successful models, and there's successful models all over the world, including mine, and can also lead to a more sustainable and equitable approach to the home care services. So prioritizing the voices and experience of those directly impacted to bring about a meaningful and lasting improvements. Go ahead. So I know we're going to have time for discussion. The one thing I just wanted to reach out to is really talk about how, as a community, we can support this as well, right? So we talk a lot about grassroots, but we really want to talk a lot about how you folks and community and other organizations can support this movement so we can all work towards a better and more just home care. Thank you, MJ. I think we're good. Thank you, everyone.
Thank you. Sorry for taking so long and crowding into your part, Danielle.
That's okay. No worries. It's hard to, yeah. I don't know if Michelle is coming back on or.
Yeah, so if you'd like to maybe, we'll ask you to, we can leave this up or you can take your, you can stop sharing and then we'll open up for audience questions or comments. It was absolutely fantastic and so eye-opening, I think, especially when you talk about mapping and you start to realize how how there's so many opportunities out there to completely transform the system. So I see we have Jennifer with her hand up.
Yeah, hi. Danielle, one of the times that we spoke in the past, one of the challenges, I think of any new home care, not just the cooperative home care sector, is getting patients to realize that it exists and that there were some barriers in that list of who a hospital or somebody provides to a patient to say, hey, here's some options that you can contact. I guess, has there been any addition to that or any good news around that? Or B, how can we help get alternatives like this cooperative home care option onto those lists, into people's perception of what home care could look like?
Yeah, thanks, Jennifer. Mary Jean, can I get you to take this slide down? I can see everybody who's trying to talk or if there's hands raised or something. Yeah, I thank you. Thanks, Jennifer. I think that what we're seeing now is that folks who are looking at receiving care are becoming more and more engaged in this concept, mostly because they have experienced, especially post-COVID, a lot of their problems. So now we're seeing a lot more people calling us just because we're a co-op. Super impressed that we engage the PSWs and the type of care that they have and the type of and giving them a meaningful work environment. I've been asked a lot by other organizations to actually speak on the co-op model. I spent a lot of time going and speaking about what to look for in a home care agency. And I tell clients the questions to ask. And always they're like, really? You can ask if they get benefits or how much they pay. And I'm like, absolutely. I brag about it. Right. So I think at the worst case scenario, if we can help set that bar so it kind of and raise the standards, that's great. But yeah, I think it's getting better. We're finding that PSWs, because of their, I think, feeling a bit jaded, we have been not treated very well over decades and decades. So I think it's hard for them to see that hope and see that concept. So sometimes it's a little bit more, but it's that culture of co-op. You understand that even when they come on to get a job, they realize very quickly that, wow, like this is a culture. They actually really mean what they say. Yeah.
Thank you.
Yeah.
Can I add to that just quickly? I just know, like, one of the things that I think for you were saying clients are really excited about it because they also realize that they're not going to have that liability kind of excuse thrown at them all the time. Like that they can actually like talk through what their care needs and make personalized kind of arrangements, right? I remember you highlighting that, and that's something that's almost never possible. It's one of the main criticisms of the dominant home care systems, right? The government subsidized ones is that they have no control over what's happening with their services at all. And it's very different with the co-op model.
I get a lot. I would say probably half, at least half of my clients to date have come to us because they have been unhappy with the co-op model. So they've already been, or sorry, unhappy. Don't put that in the recording. Um, unhappy with the public sector model and wanted to make changes. So a good portion of them have already experienced it, been a part of it, and have unhappy and said it's not, we can't be a part of it. The other part is they didn't even want to be a part of it, or they weren't eligible. So they came to us anyways. So yeah. Another thing that while we're waiting for more questions, another thing that I think is important to highlight is the lack of understanding of this system just in general. I spend a lot of time helping people navigate the system, who to call, what are the next steps, what are your rights. I talk to them about different funding models and different funding options. The questions to ask. We have lists of, criteria for them to kind of go through. And I think that that's key. So we're actually working on that being more of a formalized process. Right now, it's a very informal process, but it is taking up a good amount of my time. So we will be working on that as a more formalized service that we offer. Because it's a huge need and people are so overwhelmed at the time and they're calling from the hospital and my husband's getting discharged in 2 days and I don't know what to do. And it's just this mad panic, right? So we want to make sure we can educate people so they understand their rights and what their options are.
I have a question. What are a couple things that we can do? So the people on this call, how can we help advocate for this solution? How can we help support you? How can we help call attention to this and help you move this forward? What do you need from us? How can we support you?
Mary Jean, do you want to go first on that one?
Well, I mean, I just put the links to the power mapping that we did and the toolkit in the chat. I mean, I think there's all sorts of things, right? I'm not going to speak necessarily to the home care cooperative because obviously Danielle will be able to answer that better. But I think one of the biggest things is just, even just conversations with your family, like you mentioned, Michelle, like at the beginning, this is something that almost everybody will have some sort of encounter with at some point in their life. And it's good to know that actually are alternatives. Often people don't realize they don't have this information. They don't know who to talk to. They don't know how to navigate these things. And so even just understanding that there are levers for you, and you can advocate, and that there are some options out there, that there are ways to navigate these systems better, and that I think just starting conversations about the fact that we don't need to settle for the current systems, I think it's supportive on an individual level, right? And just word of mouth, like even your home care cooperative has only been around for a few years, right? And it's just totally taken off just because everybody's talking about it. It's such an exciting alternative. I think people are really desperate for those good news stories, right? And actually being aware that those alternatives are out there. And then thinking, I guess for me, part of what the project is really trying to motivate people to do is actually to consider working with other people, right? Like to actually start building those relationships. And understanding that we're kind of stronger together, right? When we kind of try to piece off different sides of the advocacy, and then we kind of, in some cases, people get thrown under the bus, right? I think just really thinking about the value of working with the diverse kind of stakeholders in this sector. I think that's been really powerful for you. Like you've been so successful in building bridges with disability and senior organizations through that type of mentality. And I think now people are getting really excited about migrant justice. They're saying, oh, I've never even knew that there was this movement, or that they didn't think through how this might be relevant. But there's been so much excitement about just working together. So maybe that's a little bit more organizational, but I think just having the conversations and really thinking about the possibilities is, I think, just kind of there's a momentum there, and it's, people kind of keep going once they get involved.
Mhm. I think I'll add from the co-op perspective too, and just the awareness and understanding that. But I do genuinely feel that we need supports. If we want to develop this in regards to more of a robust home care co-op model in Ontario and potentially across Canada, we need to have some funding. We need to build that awareness and have those supports. We do have a cooperative development fund, and we can get donations. We're looking for those types of supports as well. So I know that's in the end of our slide. I didn't want to kind of waste time on that. But you'll get the slides and you'll be able to look at that. So you can feel free to donate if you like to kind of support this initiative. We also look for sponsorships for different seminars and workshops that we do on the Virtual Caregiver Network. But I think the most important thing is going to be about awareness and coalition building, finding different organizations and communities that you can work together, because we're seeing it, those grassroots, organized effects are really making a big difference. I was a small little teeny 2 or 3 person co-op in 2021. And it just so happened that I got interviewed on CBC News, Marketplace, or sorry, not Marketplace, The Current. And that was an opportunity for the awareness to kind of spread. So it's those things. It's this, like, the OCA is offering an opportunity for us to talk about this, right? And we hope that you folks will go and share this with your networks as well.
Thank you so much, both of you. So I saw that Jacob had his hand up, and we also have a comment in the chat from Melanie saying, are there any opportunities for restoration companies to help in this mission? We offer services like emergency water biohazard mitigation, as well as infectious cleaning for commercial settings. We've been interested in getting involved with co-ops recently. We're just not sure the best place we could offer our assistance.
I can answer it. Thank you so much. And I'm actually really interested in what you do, because that sounds really awesome. So maybe we can chat, and feel free to reach out to us anytime. But I think what we were talking about is, partnering with different events, sponsoring different things, financial supports, coalition building, collaborative community organizations, anything that we can do to help each other and spread those words. And of course, support the workers and the co-op model moving forward. So happy to chat more about that as well.
And one more quick comment that Jane made a comment that their understanding is that Ontario Health at Home tells residents who they can have as home care.
Yes. So currently what happens is if you apply for Ontario Health at Home, that used to be the CCAC or the LIN. There's a lot of different names for it. Now it's called Ontario Health at Home. And you would apply for home care, or a doctor would refer you for home care. You would have a coordinator that would then come out and assess your needs. This is based on a check sheet. So it's not a holistic concept. It's not a holistic view on how you would get care. Once you are told that you are able to get 2 hours a week for a shower or whatever it's going to be, they put a bid out to the service providers. Those are the service providers like ParaMed that Mary Jean was talking about and referring to in the map. They'll pick up that contract, and then it's up to ParaMed at that point to really kind of decide how they're going to offer that care. So very rarely would they come in and say, when do you need this care? How can we support you? It's more like, we have a PSW available Wednesdays at 1, and we don't have anybody at this time, and we don't have anybody at this time, but they can come in at this time. And sometimes there's even several companies that are involved. So yes, Jane did, that's my aunt, by the way, but hi, Aunt Jane. And Jane is, yeah, she's had a lot of experience with home care too. So I understand that that's a big, a big concern for people. It's not a great system. And we need to move away to something else.
And it's good to know, like I didn't know until I met you, Danielle, that you can ask for a different provider. Like I don't think they
Yes.
don't there's so many things about the system that people don't realize that they have options. They're told they have one option, and there's actually, and so that's part of what is in the toolkit is
Yeah.
giving you some ideas about, how can you navigate just on an individual level for better service and to have a little bit more choice. Not a lot, but it just as an individual, but there are things you can do.
Yeah. There's a lot of times when I'm hearing people on the phone and they're talking to me about their situations, their needs that are usually quite dire. And I'll be going, okay, so you're not happy. You have, Ontario Health at Home right now. I'm hearing all of the complaints, the regular concerns that are going on. And they're now seeking private care, which as a private business, I'm still a huge proponent for publicly funded service. That needs to be a mandatory thing. Everybody should have access to that. So when I hear these people and now they're reaching out to a private system because what's happening isn't helping them, I'll ask them, have you ever heard of family managed care? It's a type of direct funding. Almost always they say no. This is through a publicly funded system. But again, nobody knows about this. Even some of the care coordinators who are in that system do not understand what the clients are able to access. So I spend a lot of time doing that. And I know that's not by mistake. This is definitely by design. We certainly don't, our system's not going to do too well if people are really educated about what their rights are, right? So we have to do that. I think Jacob, maybe had a question, so I apologize.
Yes. That's okay. And then Jane's got her hand up, and we'll go to Jane next. But Jacob, did you have a question?
It wasn't more of a question, it was more just like a comment. I just want to just say like amazing presentation. Obviously, have a little bit of knowledge regarding care, taking a few classes with Mary Jean, so I get a little bit of basis, but this was like blown right out of the park. Like I had no idea about a lot of this stuff, especially having both grandparents that are in their 80s and like having that conversation regarding care, what's accessible to them, what's able to be supportive for them, and that's quite the conversation to have. Uh, so I found this was just an awesome presentation. I don't really have a question. It's just I just want to say like amazing job to everyone.
Thank
And
you.
yeah, I mean that's pretty much it.
Yeah, thank you.
That was great, Jacob. That was amazing. Thank you. And Jane?
Yes, I would say amazing job, Danny and everyone. My experience with home care when I needed it was that I appreciated it very much. I think my intake worker did the best she could to advocate for it, but you didn't know when they were coming. You didn't know if they were coming. They didn't call and say, we can't make it. You didn't know who was coming. You'd get someone different every time. And some women here, me being one of the younger ones, it didn't matter to me if it was male or female. I would prefer a female, but I'd take what I could get. But I've heard that other people have said, no, I'm not having a man bathing me. And I understand that because they're older than me. They're a little different from me. But no, it's just, you don't know. Yesterday I was in the hall and one of the girls was downstairs and she said, I've come here to shower you. Right, everybody's there. I've come here to shower you. That should be personal. Right at the reception desk. Would you like to come now? And she said, well, I guess I have to. I guess so. I mean, that's not right. It isn't right.
Yeah. Thanks, Aunt Jane. And you just mentioned about you have to take what you can get. And that is exactly something that Mary Jean had talked about on her part, that scarcity, idea. And we don't have to take what we can get. Sometimes we may not be in that position, but today's workshop and what we're doing in this project is about making sure people are aware that there are some options. And thanks for highlighting that. I think we have.
Well, that's good because they do not know that.
Yeah.
They don't know that.
I think it's Margaret next. I don't know, Michelle.
Yeah, I think so. Yeah.
Yes, I just want to say thank you for this wonderful presentation. It is so exciting to hear what is happening in Ontario, what's happening in Canada. I'm here in the US, and we've been trying to form home care worker co-ops for, oh goodness, 25 years now. And we have about 20 across the US. And one of the things that has been helpful in helping to understand, there aren't many measures of quality when it comes to care, especially care that's based in the home. And so we have a connection called the Elevate community of the home care worker co-ops across the U.S. And for the last 7 years, we've been doing an annual survey of the worker co-ops. And one of the things that we're consistently finding is the turnover of caregivers, that across the industry, it's about 82% turnover annually in the US of home care. When home care is provided by a worker cooperative, it's between 25 and 30% turnover.
Yep.
Caregivers own it.
Yeah, no, thank you for bringing that up. And I would love to actually connect with you about that and about what you're doing in the US, because it's so important, again, about just coalition building. And it doesn't matter where we are, we can learn so much from everybody. And you're right. I've been so lucky in having an amazing team that's working with us. And I actually have the founder of the other co-op here as well. And I think it's really just about that culture and offering meaningful employment and valuing the work.
If there's any opportunity, we're having the 9th annual Home Care Co-op Conference outside of Washington, D.C., March 10th through the 14th. And that is such an empowering people on fire, caregivers on fire, people coming together, and it's just a great networking opportunity. If there's any opportunity that you can come south, please do.
Well, I am. I'm going
wish I
south.
could go.
Unfortunately, it's not there. I'm going to the Dominican during that time. So, but sorry, because I would absolutely love to do that. And let's connect about more opportunities like that for sure.
And great to know about this Elevate community.
Yes.
Like I would love to connect with that because you're right. It's also, I mean, this is, it's so hard to actually think about quality and do any kind of planning because it's completely decentralized, right? And everybody, that's why we have to spend so much time breaking down what do we mean by home care? Because it means something totally different to so many different people, right? And that's a big part of the issue. But so yeah, I would really be happy to connect too. Thank you for sharing that, Margaret.
Speaking of quality of care, and when you had another organization that speaks to that. So when we talk about the stakeholders having a voice in the Cooperative Care Alliance, which sets the standards for the HCWC and worker co-ops care. We make sure that our members have a voice at the decision-making table. So the co-ops in themselves, the PSWs in themselves have a voice and can vote. The clients and the care receivers are sitting at that table, having a voice and, and able to get their input on what quality care actually is and what just care actually is. And friends and family caregivers. Friends and family caregivers, that's a voice actually that we don't really focus on too much. But it's something that I think we need to pay a little bit more attention to, because if we don't care about them, just like we don't care about the caregivers, we see people being prematurely admitted into long-term care, more hospitalizations, because it's the families that can't take care of them. So it's a holistic concept of everybody who are the key stakeholders in home care are at that decision-making table in the Cooperative Care Alliance. So that's how you get just care, in my opinion.
Thank you. Thank you. So we're just about out of time. So I would just like to take a moment on behalf of the Ontario Cooperative Association to thank Mary Jean Hande and Danielle Turpin. Thank you so, so much. This was such an incredible conversation, so enlightening, such important information. So I would put out a call to action to everyone that's here today to spread the word. And I've included links as well in the chat for the Home Care Workers Cooperative, the Cooperative Care Alliance, and Mary Jean shared the Toward Just Care toolkit. I encourage everyone to check out those resources and the Ontario Cooperative Association as well. I put a link in there. So please, cooperatives change lives and create incredible partnerships. So I think together, this is really what we want to do, is build a better, stronger Ontario where people have a voice and we can create positive transformation and a better world for everyone. So thank you all. Thank you all, our guests, for our audience for joining us today. And I will be sharing a recording of this session. We'll have it available, as well as the slide deck as well. So thank you all again, and enjoy the rest of your week. Thank you.
And Michelle, thank you very much
Thank you
for
very much,
hosting this as
Michelle.
well. Yep. And
Pleasure.
thank you, everybody. It was great. Take care.
Thank you.